Thanks, Devin. Well, when was your last checkup? Well, hopefully you were better than me about getting your exam. And many of us wonder if we still need to continue getting exams even if we are healthy and don't have any complaints. And here to answer these questions and more is Nurse Christina Paris from the VA. Good morning, Nurse Christina. How are you doing today?
Good morning. I'm doing great.
Great to have you on again. So why do we need routine health exams?
So there's a lot of reasons that you want to go in and get a routine exam from your provider. One is just to make sure that the medications that you're taking are still appropriate, that you're taking the right dose. You want to make sure that there's nothing new going on that maybe you've been ignoring. So you can bring those kind of things up with your provider and just make sure that checks are okay. I mean, maybe you're doing so well with your diabetic management that you no longer need to be on medications. So that can sometimes be a factor.
Good positives out of those as well.
Yes, you can, right.
Does a routine health screening just involve a physical or is there more to it?
So it can involve a physical. Sometimes there is more to it. You want to go in and get checked out. For example, if you have cardiovascular, you want to check out for cardiovascular disease. If you are a smoker, they may want to do a one-time check for an abdominal aortic aneurysm. They'll look for cancers depending on risk factors, you know, family history of, say, breast cancer or things like that. They may want to do order mammograms or routine screenings. Cervical cancer, you know, they'll want to do that every 3 years if you're 21, between the ages of 21 and 29, or 5 years for the ages between 30 and 65. So it kind of depends on how old you are, what screenings. Also, they can check for lung cancer, prostate cancers, melanomas. Now those three, they'll only check if you're high risk. So they're not going to just do a test for lung cancer if you're not a smoker or you're not having coughs or things like that, you know, skin cancer. They're not going to check if you don't have a family history of it, but if you do, they will. Sexually transmitted diseases, bloodborne infections, things like that, mental health, immunizations. So there's a lot of things that they can check for.
Okay, very interesting. I didn't realize that you could do all of those things.
Right.
And is there something else that patients can request instead of a physical?
So it's best to go in and talk to your provider. You may not need to do the lab tests. You may not need to do an actual physical or a pap or pelvic or, you know, a male prostate exam, but you do want to always go in and have those at least every 3 years if you're under the age of 40.
Okay, all right, and then you were telling me earlier about shared decision making, excuse me. So what exactly is that?
Absolutely. So again, that is having those conversations with your provider. No longer is it just the doctor telling you that you have to have these lab tests or that you need to have a colonoscopy. You want to have those conversations with your doctor. You want to talk about the risks and the benefits to those.
Okay, very interesting. Good information there. And one last question. Are there any downsides to routine testing?
There are downsides to routine testing. You know, sometimes you'll get insignificant findings or incidental findings, which could be insignificant. So you do want to be careful because that can cause a lot of undue stress. You know, if you go in for a routine urinalysis, for example, and it shows that you have blood in your urine, some people, it's just their anatomy. It's just the way you're built. But it could make you, as a person who just isn't aware of that, kind of stressed out and might cause more, you know, they might want to do an ultrasound and all these things that can cause excessive copays for you, stress to go through that kind of stuff. So you want to have those conversations. Okay. Not every test is needed. Not every blood work is needed. So talk to your provider.
False positives
and there's
well.
Exactly. Yep. The risk of false positives.
All right.
Yep.
Well, thank you for bringing it or coming in again and giving us this valuable information. Well, thank you again. See you next week, by the way.
Yeah.